Today's topic is on pneumonia. So let's begin. What is pneumonia? Pneumonia is an infection that inflames the air sacs in one or both lungs. The air sacs can fill with fluid or pus, causing cough with phlegm or pus, fever, chills, and difficulty breathing. So this can be caused by a variety of organisms, including bacteria, viruses, and fungi, which can result in pneumonia. So pneumonia can range in seriousness from mild to life-threatening. It is most serious for infants and young children, people older than 65, and individuals with health problems or weakened immune systems. The causes of pneumonia. Many germs can cause pneumonia. The most common are bacteria and viruses in the air that we breathe. So your body usually prevents these germs from infecting your lungs, but sometimes these germs can overpower your immune system even if your health is generally good. So pneumonia is classified according to the types of germs that cause it and where you got the infection from. So pneumonia can affect anyone. There are many risk factors, but the two age groups at the highest risk are children who are 2 years old or younger and people who are 65 years old or older. Other risk factors include being hospitalized. So you are at greater risk of pneumonia if you're in a hospital intensive care unit, especially if you're on a machine that helps you breathe, known as a ventilator. Chronic disease. You're also more likely to get pneumonia if you have asthma or a condition known as chronic obstructive pulmonary disease, COPD, or heart disease. Also, if you're a smoker, smoking damages your body's natural defenses against bacteria and viruses that cause pneumonia. And finally, if you have a weakened or suppressed immune system. So individuals who have human immunodeficiency virus and AIDS, who have had an organ transplant or who receive chemotherapy or long-term steroids are also at risk of pneumonia. So you can be hospitalized if you have pneumonia, if you are older than the age of 65, you're confused about the time, people or places, if you have decreased kidney function, if your systolic blood pressure is below 90 millimeters of mercury, or your diastolic blood pressure is 60 millimeters of mercury or below. Also, if your breathing is rapid, meaning 30 breaths or more a minute. If you need breathing assistance, if your temperature is below normal, if your heart rate is below 50 or above 100, and you can also be admitted to the intensive care unit if you need to be placed on a breathing machine, ventilator, or if your symptoms are severe. Also, children can also be hospitalized if they are younger than 2 months, they are lethargic or excessively sleepy, they have breathing problems, they have low blood oxygen levels, and they also have dehydration. Even with treatment, some people with pneumonia, especially those in high risk groups, can experience complications. These include bacteria in the bloodstream, bacteremia. So bacteria that enter the bloodstream from your lungs can spread the infection to other organs, and this can result in organ failure. Also, there's difficulty breathing. So if your pneumonia is severe or you have chronic underlying lung diseases, you can have trouble breathing in enough oxygen. So this can result in hospitalization, and you need to use a ventilator while your lung heals. You can also get fluid accumulation around the lungs in a process known as pleural effusion. So pneumonia can cause the fluid to build up in thin space between layers of the tissue that line the lungs and chest cavity, also known as a pleura. So if the fluid becomes infected, you will need to have it drained through a chest tube or removed with surgery. And finally, you can also end up with a lung abscess. So this is if pus forms in a cavity in the lung. An abscess is usually treated with antibiotics. So sometimes you'll need surgery or a drainage with a long needle or tube placed into the abscess if it's needed to remove the pus. Prevention of pneumonia, there's various things you can do. So firstly, you get vaccinated. So vaccines are available to prevent some types of pneumonia and the flu. You can talk to your doctor about getting these shots. Also, we need to make sure that children are vaccinated. So children get a different pneumonia vaccine, especially those age between the age 2 and for age 2 to 5 who are at risk of pneumococcal disease. Children who also attend a group childcare centre should also get the vaccine. Doctors also recommend flu shots for children older than 6 months. You can also practice good hygiene to protect yourself against respiratory infections, and that's by washing your hands regularly or using an alcohol-based sanitizer. Don't smoke. By smoking, this can damage your lungs' natural defences against respiratory infections, and you need to keep your immune system going strong. By this means by getting enough sleep, exercising regularly, and eating a healthy diet. Symptoms of pneumonia can vary from mild to severe depending on the factors such as the type of germ causing the infection and your overall age and health. So mild signs and symptoms often are similar to those of a cold or flu, but they last longer. So signs and symptoms of pneumonia can include chest pain when you breathe or cough, confusion or changes in mental awareness in adults aged 65 or older, producing phlegm while coughing, fatigue, fever, sweating and shaking chills, lower than normal body temperatures, nausea, vomiting or diarrhea, and shortness of breath. So newborns and infants may not show any sign of infection, or they may vomit, have a fever and cough, appear restless or tired and without energy, or have difficulty breathing and eating. So there is something called community-acquired pneumonia. So this is the most common type of pneumonia. So this occurs outside of hospitals or other healthcare facilities, and this can be caused mainly by bacteria known as Streptococcus pneumoniae. So this type of pneumonia can occur on its own or after you've had cold or flu. It can affect one part of the lung in a condition known as lobar pneumonia. You have bacteria-like organisms such as Mycoplasma pneumoniae, and this produces milder symptoms than other types of pneumonia. So walking pneumonia is the informal name given to this type of pneumonia, which typically isn't severe enough to require bed rest. Fungi can also cause pneumonia, and this is most common in people with chronic health problems or weakened immune systems, and in people who have inhaled large doses of these organisms. The fungi that cause pneumonia can be found in soil or bowel droppings and vary depending upon the geographical location. Viruses, including COVID-19, can cause pneumonia. So viruses are the most common cause of pneumonia in children younger than 5 years. So viral pneumonia is usually mild, but in some cases it becomes very serious. So COVID-19 can cause pneumonia, which becomes severe. That was community-acquired pneumonia. Now there's hospital-acquired pneumonia. So some people catch pneumonia during a hospital stay for other illnesses. Hospital-acquired pneumonia can be serious because the bacteria causing it can be more resistant to antibiotics and because the people who get it are already sick. People who are on breathing machines, ventilators, often used in intensive care units, are at higher risk of this type of pneumonia. There's also healthcare-acquired pneumonia. So this is a bacterial infection that occurs in people who live in long-term care facilities or who receive care in outpatient clinics, including kidney dialysis centres. So like hospital-acquired pneumonia, healthcare-acquired pneumonia can be caused by bacteria that are more resistant to antibiotics. Another type of pneumonia is aspiration pneumonia. So this occurs when you inhale food, drink, vomit or saliva into your lungs. So aspiration is more likely if something disturbs your normal gag reflex, such as a brain injury or swallowing problem, or excessive use of alcohol or drugs. To diagnose pneumonia, firstly you can use blood tests. So blood tests are used to confirm an infection and try to identify the type of organism causing the infection. However, precise identification isn't always possible. You have a chest X-ray which helps your doctor diagnose pneumonia and determine the extent and location of the infection. However, this can't tell your doctor what kind of germ is causing pneumonia. You can have pulse oximetry which measures the oxygen level in your blood. Pneumonia can prevent your lungs from removing enough oxygen into your bloodstream. You can have a sputum test where a sample of fluid from your lungs is taken after a deep cough and analysed to help pinpoint the cause of infection. If your pneumonia isn't clearing as quickly as expected, you can have a CT scan. So a chest CT to obtain a more detailed image of your lungs. You can have pleural fluid culture done where a fluid sample is taken by putting a needle between your ribs from the pleural area and analysed to help determine the type of infection. These are different ways that help the pneumonia diagnosis. Treatment for pneumonia involves curing the infection and preventing complications. People who have community-acquired pneumonia usually can be treated at home with medication. Although most symptoms ease in a few days or weeks, the feeling of tiredness can persist for a month or more. So the specific treatments depend on the type and severity of pneumonia, your age and your overall health. The options include antibiotics. So these are used to treat bacterial pneumonia. So So it can take time to identify a type of bacteria called pneumonia and to choose the best antibiotic to treat it. So if your symptoms don't improve, your doctor may recommend a different antibiotic. Cough medicine. This medicine can be used to calm your cough so that you can rest. Because coughing helps loosen and move your fluid from your lungs, it's a good idea not to eliminate your cough completely. In addition, you should know that very few studies have looked at whether the over-the-counter cough medicines lessen coughing but cause pneumonia. You can use fever reducer or pain relievers needed for fever discomfort. So these include drugs such as aspirin, ibuprofen, and acetaminophen, Tylenol, Advil, Motrin IB, and others. So looking at this list here, so antibiotics to treat the bacterial infection, you can have levofloxacin and azithromycin. Antivirals to treat viral pneumonia, you can have oseltamivir and zanamivir. For antifungals, if it's caused by fungi, you can have fluconazole and itraconazole. For analgesia to ease the symptoms of pain, you can have acetaminophen or ibuprofen. Cough suppressants, you can have dextromethorphan or codeine. And for fever reducers, you can have aspirin, ibuprofen, as mentioned before, Advil, Motrin IB, and acetaminophen. That's the end of today's video. So I hope you've learned about the different types of pneumonia you can get and the different types that cause it. So you get your hospital-acquired pneumonia, community-acquired pneumonia, etc. And the different types of organisms that cause it, such as your fungi, your viruses, your bacteria, such as mycoplasma, or streptococcus pneumoniae, etc. And the differences. That's the end of today's video, so please tune in for more. Thank you, bye-bye.